define theories, explain the health promotion model and explain in one. First in the introduction, theories are a set of interrelated concepts that give a systematic view of a phenomenon that is explanatory and predictive in nature. Then theory in the definition. A theory is a set of interrelated construct, definition and proposition that present a systematic view of the phenomenon by specifying relationships among variables with the purpose of explaining and predicting the phenomenon. Then health promotion model. Introduction. The health promotion model HPM proposed by Nola J. Pender. It defines health as a positive dynamic state, not merely the absence of disease. Health promotion is directed at increasing a client's level of well-being. Next, the model focus on the following three areas: individual characteristic and experience, behavior specific, cognition and affect, then behavioral outcomes. ഇതാണ് പെൻഡറിൻ്റെ ഹെൽത്ത് പ്രൊമോഷൻ മോഡൽ. നമ്മൾ പറഞ്ഞു മെയിനായിട്ട് 3 കാര്യത്തിലാണ് ഫോക്കസ് ചെയ്യുന്നത്: ഇൻഡിവിജ്വൽ ക്യാരക്ടറിസ്റ്റിക്സ് ആൻഡ് എക്സ്പീരിയൻസസ്, ദെൻ ബിഹേവിയർ സ്പെസിഫിക് കോഗ്നിഷൻ ആൻഡ് എഫക്റ്റ്, ദെൻ ബിഹേവിയറൽ ഔട്ട്കം. അതിൽ ഫസ്റ്റ് എന്താണ്? പ്രയർ റിലേറ്റഡ് ബിഹേവിയർ, അതിന് താഴെ പേഴ്സണൽ ഫാക്ടർ, ബയോളജിക്കൽ, സൈക്കോളജിക്കൽ, സോഷ്യൽ കൾച്ചറൽ. ദെൻ രണ്ടാമത്തേതിൽ എന്താ? ഫസ്റ്റ് പെർസീവ്ഡ് ബെനിഫിറ്റ്സ് ഓർ ആക്ഷൻ, perceived barrier to action, then perceived self efficiency, activity related effect, then interpersonal influence, family, peers, providers, norms, support model, then situational influences, next എന്താണ്? immediate corporate combating demands, low control and preferences, high control, then commitment to a plan of action, then health promoting behavior. Then assumption of the health promotion model. The HPM is based on the following assumptions, which reflects both nursing and behavioral science perspectives. Individuals seek to actively regulate their own behavior. Individuals in all their psychosocial complexity interact with the environment, progressively transforming the environment and being transformed over time. Then health professionals constitute a part of the interpersonal environment which exert influence on persons throughout their lifespan. Self-initiated reconfiguration of person environment interactive pattern is essential to behavior change. Then theoretical proposition of the health promotion model. The HPM is based on the following theoretical proposition: prior behavior and inherited or acquired characteristic influence beliefs, affect, and enactment of health promoting behavior. Next, person commit to engaging in behavior from which they anticipate deriving personally valued benefits. Then perceived barriers can constrain commitment to action, a mediator of behavior as well as actual behavior. Then perceived competence or self-efficiency to execute a given behavior increases the likelihood of commitment to action and actual performance of the behavior. Then greater perceived self-efficiency results in fewer perceived barriers to specific health behavior. Then positive effect toward a behavior result in greater perceived self-efficiency, which can turn result increased positive effect. The major concepts and definitions of the health promotion model: individual characteristic and experience, next prior related behavior, then frequency of the similar behavior in the past, direct and indirect effects on the likelihood of engaging. Then personal factors categorized as biological, psychological and socio-cultural. These factors are predictive of a given behavior and shaped by the nature of the target behavior being considered. Then personal biological factors include variables such as age, gender, body mass index, puberty, pubertal status, aerobic capacity, strength, agility or balance. Then personal psychological factor include variables such as self-esteem, self-motivation, personal competence, perceived health status and definition of health. Next, socio-cultural factors include variables such as race, ethnicity, acculturation, education, socioeconomic status, then behavioral specific cognition and effect, then perceived benefit of action, anticipated positive outcome that will occur from health behavior, then perceived barrier of action, anticipated, imagined, or real blocks and personal costs of understanding a given behavior, then perceived efficiency, judgment of personal capability to organize and execute a health promoting behavior, perceived self-efficiency, efficacy influences perceived barriers to action. So higher efficacy result in lowered perception of the barriers to the performance of the behavior. Then activity related effect, subjective positive or negative feeling that occur before, during, the following behavior based on the stimulus properties of the behavior itself. Activity related effect influences perceived self-efficacy, which means the more positive the subjective feeling, the greater the feeling of efficacy. Then interpersonal influences. Cognition concerning behaviors, beliefs or attitudes of the others. Then interpersonal influences include norms, social support, modeling. Then situational influences, personal perceptions and cognitions of any given situation or context that can facilitate or embed behavior. Then include perceptions of the options available, demand characteristics and aesthetic features of the environment in which given health promoting is proposed to take place. Situation influences may have direct or indirect influences on the health behavior.